Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a nephrologist talking to a patient named Laura Thompson, who has been recently diagnosed with IgA nephropathy, called Buerger's disease. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mrs. Thompson. Your GP referred you to me so we can discuss your recent diagnosis of IgA nephropathy, also known as Buerger's disease. How are you feeling today?
Honestly, doctor, I'm still trying to wrap my head around it. I've never heard of Buerger's disease before. When the GP mentioned it, I was shocked. I've always been healthy, and this seems so out of the blue.
I completely understand. IgA nephropathy can be quite overwhelming to hear about, especially when it's something unfamiliar. Let's start by discussing what it is and how we can manage it. Can you tell me about the symptoms that led you to see your GP?
Well, it started with me noticing blood in my urine a few months ago. It wasn't every time, but it was enough to make me worried. At first, I thought it might be an infection or something minor. But when it didn't go away, I decided to see my GP. They ran some tests, and that's when they found the problem with my kidneys.
Seeing blood in your urine, known as hematuria, can definitely be alarming. It's one of the more common signs of IgA nephropathy. Did you experience any other symptoms, like swelling in your legs or high blood pressure?
Now that you mention it, yes. I've noticed my ankles have been more swollen than usual, especially in the evenings. And during my last checkup, my GP said my blood pressure was higher than it should be. But I didn't think much of it at the time. I thought it was just stress from work.
These symptoms are typical of Buerger's disease. The condition involves the buildup of IgA antibodies in your kidneys, which can cause inflammation and damage over time. It's good that we caught it when we did. With proper management, we can slow down its progression.
That's a relief to hear. But what kind of treatment are we talking about? Is it medication or something more serious like dialysis?
The treatment varies depending on how advanced the disease is and how much your kidney function is affected. In your case, since we've caught it relatively early, we'll start with managing your blood pressure and reducing the inflammation in your kidneys. We'll likely prescribe an ACE inhibitor or an angiotensin receptor blocker to help protect your kidneys and lower your blood pressure.
Okay, that sounds manageable. Are there any side effects I should be worried about?
Most people tolerate these medications well, but like any medication, there can be side effects. These might include dizziness, fatigue, or an increased potassium level. We'll monitor your blood work regularly to ensure everything stays within a safe range. If needed, we can adjust your treatment plan.
That makes sense. I'm willing to do whatever it takes to keep this under control. But doctor, what does this mean long term? Will I need to take these medications forever, or is there a chance the disease will go away?
IgA nephropathy is a chronic condition, which means it won't go away completely. However, with the right treatment, many people can manage their symptoms and maintain good kidney function for many years. We'll also discuss lifestyle changes, such as reducing salt intake, eating a balanced diet, and possibly limiting protein, which can help reduce the strain on your kidneys.
I'll do whatever I need to. I just want to avoid things getting worse. I've read that some people end up needing a kidney transplant. How likely is that?
It's true that in some cases, IgA nephropathy can lead to kidney failure, which may require dialysis or a transplant. However, this doesn't happen to everyone. The goal of your treatment is to prevent that outcome. By staying on top of your health and following the treatment plan, you have a good chance of maintaining your kidney function for many years.
Thank you, doctor. I feel a bit more at ease knowing there's a plan in place. I guess I was just scared because I didn't know what to expect.
It's completely normal to feel that way, but remember, you're not alone in this. We'll work together to manage your condition, and I'll be here to support you every step of the way. Do you have any other questions or concerns?
Not right now. I just want to focus on getting better and staying healthy.
That's the right attitude, Mrs. Thompson. We'll set up a follow-up appointment in a few weeks to see how you're responding to the treatment. In the meantime, if you notice any new symptoms or have concerns, don't hesitate to reach out.
I will, thank you, doctor. I appreciate your help.
You're welcome. Take care, and we'll talk soon.
Extract 2, questions 13 to 24. You hear a GP talking to a patient named Mr. Foster, who has concerns about excessive hair growth. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Foster. I'm Dr. Stevens. I see you've come in today to discuss some concerns about your hair growth. Could you tell me what's been happening?
Good morning, Doctor. Yes, it's something that's really been bothering me. Over the past year, I've noticed excessive hair growth all over my body. It's not just in the usual places, it's on my face, back, and even my hands. It seems to be getting worse, and I'm not sure why.
That does sound concerning. You mentioned it started about a year ago. Have you noticed any particular areas where the hair growth is more pronounced or any changes in your routine around the time it began?
It's pretty much everywhere, but the hair on my face and back is the thickest. I haven't changed much in my routine. I thought it might be a reaction to something, but I can't figure out what it could be.
When did you first start noticing these changes? Has anything about your health or medications changed around that time?
It was about 12 months ago. I did start a new medication for my high blood pressure around that time, but I'm not sure if it's related. Other than that, nothing else has really changed.
Some medications can cause an increase in hair growth as a side effect, but it's usually more localized. Given the extent of your symptoms, it might be something more complex, possibly a condition called hypertrichosis, which causes abnormal hair growth in areas where hair is not typically prominent.
Hypertrichosis? I've never heard of that. What causes it?
Hypertrichosis can have several causes. It might be hereditary, meaning it runs in families, or it can develop due to other factors such as medication, hormonal imbalances, or even as a symptom of a more significant underlying condition. We would need to explore these possibilities to determine the cause in your case.
I see. Is there a way to diagnose it and figure out what's causing it for me?
Yes, we can start by running some tests. We'll likely do blood work to check for hormonal imbalances and review your current medications more closely. We might also look into your family history to see if there's a genetic link. Depending on the results, we can discuss treatment options that could help manage the hair growth.
That sounds like a good plan. I'm really hoping to find some answers. It's becoming difficult to deal with, both physically and emotionally.
I can imagine this has been challenging. In the meantime, have you tried any methods to manage the hair growth, like shaving, waxing, or other hair removal treatments?
I've tried shaving, but it grows back quickly, and it's really thick. I've also tried waxing, but it's painful and doesn't seem to last very long. It's like nothing I do helps, and it's affecting my self-esteem.
That's understandable. There are other options, such as laser hair removal or prescription creams that can slow down hair growth. However, these treatments are more effective when we know the underlying cause. If we find that the hypertrichosis is linked to your medication, we might consider adjusting your treatment plan to see if that helps.
I would be open to trying new treatments, especially if they could give me longer-lasting results. How long would it take to see changes with these treatments?
If we try something like laser hair removal, you may start to see results after a few sessions, but it can take several treatments to achieve significant reduction. Prescription creams can also take a few months to show noticeable changes. However, it's important to remember that the effectiveness varies from person to person, depending on the cause and the severity of the hair growth.
Okay, I understand. I'm willing to give it a try. I just want to feel like myself again.
That's completely reasonable, Mr. Foster. We'll take it step by step. First, let's run the necessary tests to pinpoint the cause. Then we can develop a treatment plan that suits your needs. I'll also provide some guidance on managing hair growth in the meantime to help you feel more comfortable.
Thank you, Dr. Stevens. I really appreciate your help. It's been a tough time, and I just want to find a solution.
We'll work on it together. I'll arrange for the tests, and we can meet again once we have the results. In the meantime, take care and try not to worry too much. We'll find a way to manage this.
Thanks, Doctor. I'll do my best. I'm looking forward to getting some answers.
You're welcome, Mr. Foster. We'll get to the bottom of this. See you soon.
See you, Doctor. Thanks again.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear an audiologist talking to a patient who's trying hearing aid.
Good morning. How are you feeling with the hearing aid so far?
They're okay, I guess. I can hear better, but everything sounds a bit too loud, and some sounds are kind of tinny.
That's common when you first start wearing hearing aids. Your brain needs some time to adjust to the new sounds. We can fine-tune the settings to make them more comfortable.
I'm worried about whether I'll be able to adjust them on my own if I need to. It's a bit overwhelming.
I understand. Let's go over the controls together so you feel more confident. We can also set up a follow-up appointment to check in on how you're doing.
That would be helpful. I also noticed some feedback when I put them in earlier, like a high-pitched whistling sound.
That can happen if the fit isn't quite right or if there's something blocking the microphone. We'll check the fit and make any necessary adjustments.
Now look at question 26. You hear Nurse Alex asking Dr. Patel for help with a patient who received a COVID-19 vaccine. Now read the question.
Dr. Patel, could you help me with the patient in room 205? The gentleman who received his COVID-19 vaccine yesterday.
Ah, yes. He's due for discharge today, isn't he? How's he feeling?
Physically, he's doing well, but he's quite anxious about potential side effects. He's worried about the fever and muscle aches he might experience.
Understandable. Let's go see him together. Reassurance is essential after vaccination. Has he been informed about the common post-vaccine symptoms?
Yes, I explained it to him, but he's still concerned. Perhaps you could provide additional reassurance?
Of course. We'll address his worries and ensure he's well informed. And let's check his analgesia while we're at it.
Now look at question 27. You hear a senior nurse discussing a new patient education program on her ward. Now read the question.
We've recently implemented a new patient education program to enhance patients' understanding of their conditions and treatment plans. We've created interactive workshops that cover topics like medication management, symptom recognition, and self-care techniques. The workshops are conducted by a team of nurses and healthcare providers who use engaging materials and real-life examples to make the information accessible and relevant. We've noticed a significant improvement in patients' confidence and ability to manage their health since the program started. Additionally, we've incorporated feedback from participants to continuously refine the content and delivery of the workshops. This ongoing improvement process ensures that the education provided remains up-to-date and tailored to patients' needs. The positive outcomes from this initiative have encouraged us to consider similar programs for other aspects of patient care, further promoting proactive health management and improving overall patient satisfaction.
Now look at question 28. You hear two doctors discussing the diagnostic tests for a patient with chest pain. Now read the question.
I just got a call from the ER. They have a 70-year-old patient with chest pain. They suspect a heart attack and want to order a cardiac CT.
That's a good call, but given the patient's age, we should consider an ECG first. It's faster and can rule out a heart attack in many cases.
Agreed. If the ECG is inconclusive, then we can proceed with the CT. But let's prioritize the ECG to minimize radiation exposure. It's important to be cautious with older patients, especially when considering tests that involve radiation.
Good plan. What if the ECG shows a heart attack?
Then we'll need to proceed with a cardiac catheterization to confirm the diagnosis and potentially open the blocked artery. We should also prepare the patient and family for the possibility of an immediate intervention.
Okay, let's call the ER back with our plan.
Now look at question 29. You hear part of a surgical team's briefing. Now read the question.
All right, let's discuss Mr. Gupta's case. He's scheduled for a coronary artery bypass graft. Any concerns about his medical history?
He has a history of chronic obstructive pulmonary disease (COPD). His lung function is stable, but we might need to adjust the ventilation settings. We should also be cautious with anesthesia, as patients with COPD can be more sensitive.
Will we need any special equipment due to his COPD?
No, we should be able to manage with standard equipment. However, we might need to monitor his oxygen saturation more closely, especially during induction and emergence. Close monitoring will help us respond quickly to any respiratory issues that may arise.
And what about his medications? Should we adjust any of them preoperatively?
We'll need to consult with his pulmonologist to determine if any adjustments are necessary.
Now look at question 30. You hear a researcher discussing a study on telemedicine in rural healthcare. Now read the question. We are conducting a study on the effectiveness of telemedicine in rural healthcare settings. The goal is to assess how telemedicine can improve access to care, reduce wait times, and enhance patient outcomes in areas with limited healthcare resources. We are looking at a variety of factors, including patient satisfaction, adherence to treatment plans, and overall health outcomes. While there's growing evidence supporting the benefits of telemedicine, more research is needed to understand its long-term impact and identify the best practices for implementation. In addition, we aim to explore the challenges faced by healthcare providers in these settings, such as technology barriers and training requirements. Understanding these challenges will help us develop strategies to overcome them, ensuring that telemedicine is both effective and sustainable. We hope that the findings from this study will contribute valuable insights into how telemedicine can be integrated into rural healthcare systems, ultimately improving the quality of care for underserved populations. That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a conversation between an interviewer and Dr. Emily Harris discussing medical innovations today. You now have 90 seconds to read questions.
Hello and welcome to Medical Innovations today. For years, antibiotics have been the go-to treatment for various bacterial infections. However, recent research from a global consortium of medical experts suggests that overuse of antibiotics may do more harm than good. To discuss this critical issue, my guest today is Dr. Emily Harris, a leading infectious disease specialist from Harvard Medical School. Dr. Harris, welcome.
Thank you for having me.
So, Dr. Harris, why have antibiotics been prescribed so liberally for so long?
Well, it's a great question. Historically, antibiotics were seen as a miracle cure, and they have saved countless lives since their discovery. However, the challenge is that as their use became widespread, they started being prescribed for conditions that they might not be necessary for, like viral infections. This overprescription stems from a combination of patient expectations, the medical community's desire to provide a solution, and a lack of awareness about the long-term consequences of antibiotic overuse.
So, would you say this is more of a cultural habit than a scientifically backed practice?
Absolutely. In many cases, the decision to prescribe antibiotics was driven more by tradition than by evidence. When antibiotics first became available, they were used cautiously, but over time, as they proved effective, the threshold for their use dropped. This wasn't always based on rigorous science, but rather on the belief that they were a quick fix. We now know that using antibiotics indiscriminately can lead to antibiotic resistance, which is a significant public health concern.
That brings us to the issue of antibiotic resistance. How serious is this problem?
It's a very serious issue. Antibiotic resistance occurs when bacteria evolve to survive the drugs meant to kill them. This means that infections that were once easily treatable can become deadly because the antibiotics no longer work. According to the World Health Organization, antibiotic resistance is one of the biggest threats to global health, food security, and development today. It's estimated that by 2050, antibiotic-resistant infections could cause 10 million deaths annually if no action is taken.
That's quite alarming. What steps are being taken to combat antibiotic resistance?
There are several strategies being implemented globally. First, there's a push for more prudent use of antibiotics, only prescribing them when absolutely necessary and ensuring the right drug is used for the right infection. Second, there's a significant focus on developing new antibiotics and alternative treatments. Finally, education is key, both for healthcare professionals and the public, to reduce the demand for antibiotics when they are not needed.
Have there been any major successes in these efforts so far?
Yes, there have been some notable successes. For example, in countries like Sweden and the Netherlands, strict guidelines on antibiotic use have led to a significant decrease in antibiotic resistance rates. Additionally, global initiatives like the WHO's Global Action Plan on Antimicrobial Resistance are making strides in raising awareness and promoting research. However, there's still a long way to go, especially in countries where access to antibiotics is less regulated.
And what about the future? What can we expect in terms of advancements in this field?
The future is promising, though challenging. Researchers are exploring new types of antibiotics, including those that target specific bacterial mechanisms, reducing the likelihood of resistance. There's also exciting work being done on phage therapy, which uses viruses that specifically target bacteria, and on harnessing the immune system to fight infections. The key will be balancing innovation with responsible use to ensure that we don't find ourselves in the same situation with new treatments.
So, to summarize, should people be worried about antibiotic resistance, and what can they do to help?
Yes, it's definitely something to be concerned about, but it's not too late to make a difference. People can help by not demanding antibiotics for viral infections like the cold or flu, by following their healthcare provider's advice when they are prescribed antibiotics, and by practicing good hygiene to prevent infections in the first place. Every small action contributes to the larger fight against antibiotic resistance.
Thank you, Dr. Harris, for shedding light on this important issue. It's clear that while antibiotics have been a powerful tool in medicine, we need to be more mindful of how we use them.
Thank you for the opportunity to discuss this critical topic. Extract 2. Questions 37 to 42. You hear a doctor giving a presentation about evolving role of telemedicine in healthcare. Now, read the questions. You now have 90 seconds to read questions. Hello, I'm Dr. Amelia Hartman. Today, I'd like to discuss the evolving role of telemedicine in healthcare, particularly in light of recent technological advancements. Telemedicine is not a new concept, but its significance has grown exponentially, especially during global health crises. What once started as a tool for remote consultations has now expanded into a comprehensive platform that supports everything from chronic disease management to mental health services. One of the most compelling aspects of telemedicine is its ability to break down geographical barriers. Traditionally, patients in rural or underserved areas had limited access to specialized care. Now, with telemedicine, a patient living in a remote area can consult with a top specialist hundreds of miles away without ever leaving their home. This increased accessibility is particularly beneficial for individuals with chronic conditions who require regular monitoring and adjustments to their treatment plans. Additionally, telemedicine has proven to be a game changer for mental health services. The stigma surrounding mental health often prevents individuals from seeking help. However, telemedicine provides a level of privacy and convenience that encourages more people to seek therapy or counseling. For example, a patient can now attend a virtual therapy session during their lunch break without worrying about being seen entering a therapist's office. This convenience not only reduces the stigma but also allows patients to access care at a time and place that suits them best. Telemedicine is also playing a crucial role in improving patient compliance. Studies have shown that patients are more likely to adhere to their treatment plans when they can regularly check in with their healthcare providers. Telemedicine platforms often include features like automated reminders, digital health records, and even virtual support groups. These tools help patients stay on track with their treatment, which is particularly important for managing chronic diseases like diabetes or hypertension. Moreover, telemedicine is revolutionizing emergency care. For instance, stroke patients require immediate assessment and treatment to minimize brain damage. With telemedicine, emergency room doctors in rural hospitals can instantly connect with neurologists in urban centers for guidance on administering clot-busting drugs. This real-time collaboration can make the difference between a full recovery and permanent disability. However, telemedicine is not without its challenges. One of the biggest concerns is the digital divide. Not everyone has access to high-speed internet or the latest technology, which can limit the effectiveness of telemedicine. Additionally, there are concerns about data privacy and security. As more health data is transmitted electronically, there is a greater risk of breaches. It's essential for healthcare providers to implement robust security measures to protect patient information. Another issue is the potential for telemedicine to depersonalize healthcare. While virtual consultations are convenient, they lack the physical interaction that can be crucial for diagnosis and treatment. For example, a physician cannot perform a physical exam or notice subtle changes in a patient's appearance over a video call. This limitation highlights the importance of integrating telemedicine with traditional in-person care, rather than viewing it as a complete replacement. Looking forward, the future of telemedicine seems promising. Advances in artificial intelligence and machine learning are expected to enhance telemedicine platforms, making them more intuitive and capable of providing personalized care. For example, AI could analyze patient data in real time to predict potential health issues before they become serious, allowing for early intervention. Additionally, wearable devices that monitor vital signs could seamlessly integrate with telemedicine platforms, providing doctors with continuous data on their patients' health. Furthermore, the integration of telemedicine with other digital health technologies, such as electronic health records and patient portals, will create a more cohesive healthcare experience. Patients will be able to access their medical history, schedule appointments, and even order prescriptions all from one platform. This integration will not only streamline the healthcare process but also empower patients to take a more active role in managing their health. In conclusion, while telemedicine is not without its challenges, the benefits it offers are undeniable. It has the potential to make healthcare more accessible, convenient, and personalized. As technology continues to evolve, so too will the capabilities of telemedicine, paving the way for a future where quality healthcare is within reach for everyone, regardless of location or socioeconomic status. That is the end of Part C. You now have 2 minutes to check your answers.